Starting the microneedling procedure, you take off the plastic bung that is attached to the top of the cartridge, and then you adjust your depth setting to 0.25 to 0.5 when we start at the forehead area. On my model, we're doing an epidermal treatment, which means that there'll be erythema, so slight redness. If we were doing a dermal treatment, we would be drawing blood, and that is more for anti-aging and going deeper in the skin. I'm using the hyaluronic acid glide serum from Ivan Med, and we're going to saturate the skin with the serum. I do this in parts because the serum does dry up. You don't want to waste any product, so we just apply it to the area that we're working on and work in sections. And to avoid cross-contamination, you'll put the serum into a disposable gauze or into a kidney bowl. If using other serums such as Clinicare, you can draw up the solution with a sterile syringe and place that onto the area you're treating. You do needling in roughly 3 sections, so you'll go up with the needle, then you'll go diagonally and across, almost like the Union Jack flag pattern. As you can see here, I draw the needle up and down on the forehead, slowly making sure we cover the whole surface area, then across, and then diagonally. When working with clients, you can ask them if the pressure or the depth is too much, and you can adjust that speed or that depth depending on how comfortable or uncomfortable they are. Try and stretch the skin where possible to ensure maximum comfort for the client, so you're not pulling and dragging the skin. If using a more watery substance serum like the Clinicare solutions, you'll need to draw up roughly 2 ml of product to use on the face. And if there's any excess serum left, you can apply that after the microneedling procedure is done, just topically onto the skin, and that will be absorbed through the microchannels from the microneedling. After microneedling, you got a 400% increase of absorption of product than you would than putting it topically on the skin without microneedling and creating those microchannels into the skin. Then we're going to move down to the cheek area. So get your client to turn their face just to ensure the product doesn't drip down the side of their face. With other serums that are more watery, you want to make sure the client has completely turned their face. And then when you apply the product, to make sure that you block their nose or the mouth in case the product leaks into that area. Here I'm adjusting the speed because of the cheek area we can go deeper with the depth. So I will be adjusting it to around 1 to 1.5. For more mature clients with thinner skin, they may not be able to tolerate the 1.5 max depth for the cheek area, so you can adjust that by doing a pass and seeing how they react to the needle depth and lowering if you need to. You can see right away some redness and erythema, which means we're at the right depth and we're causing that trauma to the skin, which is what we want for the collagen induction process. You want to keep the microneedling device and the needle within the skin. You don't lift off of the skin, because the way that the microneedling devices work is that the mechanism has a pullback of the needle that comes back and injects into the skin at a 90-degree angle. So it does that back and forth motion for you, so you don't need to lift off of the skin, and this ensures comfort for the client also. The device has a precise and controlled vertical puncture of fine needles that create tiny openings in the skin, and that stimulates the skin's natural wound healing response, which will produce collagen and elastin. If a client has a concern or problem area on the skin, such as pigmentation, fine lines or dehydration, you can give extra attention to that area by going over it for a second time. In some cases, you may see that the erythema is not consistent throughout the face, so just keep an eye on it, and at the end of the procedure, if there are some patches of white where the erythema is not consistent, you can go back over it. Moving to the chin area, I adjust my speed and my depth to around 1 because this is a more sensitive area. Anywhere around the lips is normally more sensitive for the client. I then apply serum to the top of the lip. Again, this is such a sensitive area for the client, so make sure you've got enough product to create that slip. As this is a small area, you can get your client to pull their top lip over their teeth so you have enough stretch. And you can see it's quite uncomfortable for my clients, so we try and make this part of the procedure quite quick. I'm now adjusting the depth of my needle to around 0.25 to 0.5 for the delicate skin and thinner skin of the nose area. You can check with your client how they feel. and then adjust the depth and the speed according to how comfortable they are. This is a great area to teach as it's around the T-zone, so most clients will find they have open or large pores, blackheads and congestion. So this will help minimise those pores and oxygenate those tissues to stop those comedones and that congestion. The way in which you work around the face doesn't matter as long as the whole face is covered. Work in whatever sections make more sense to you. You can also include areas like the actual lip of the client on a lower setting such as 0.25 if they want hydration in the lip, and you can go over the eyebrow hair to stimulate hair production and to minimise pores in the area. Here I've adjusted the client. Don't be afraid to move the client to make sure that you are comfortable and can position yourself and angle the needle to get around the contours of the face. I like the serum that I have from the Med collection because it doesn't spread or run or dry out, and as you can see I've done blebs of product that will stay in place, and I can use that to continue to spread it around the surface area of the cheek or the area that I'm treating before it dries out, so you don't get any waste of product. Again, working all the way up to the jawline and by the ear, making sure you cover the whole surface area of the face as you've cleansed everywhere so we know that it's clean, and doing those up and down motions and then zigzag, spreading that product, making sure there's slip and there's comfort for the client. You can make sure that you cover the nasolabial folds, as most clients will find that they have dents or creasing here, then you can soften those lines by causing those micro injuries in the skin. On the cheek area, make sure you're working below the orbital rim and staying in that 1 to 1.5 depth. When working above the orbital rim, the skin there is thinner, so you'll be working around 0.25 to 0.5 depth. Now for the under eye area, this is the thinnest skin on the face. It's around 0.25 millimeters thick. We're going to adjust the depth to 0.25 on the pen, and just going slightly above the orbital rim, pulling the skin down to ensure a nice tight stretch. This might feel weird for the client where it seems like it's vibrating near the eyes, just see how much they can tolerate. Going all the way around the eyes by the temple at the same depth and ensuring that consistent erythema. Working around the thinner skin around the eyes is really good for tightening up that skin and creating thicker tissue and laxity, and helping in areas where people normally would get anti-wrinkle injections for around the crow's feet area. My client has a patch of pigmentation here, so we're using a stamping motion to go over what looks like a freckle, which is from sun damage, which can help to break down that pigment. Now I'm adjusting my client to turn her face so we can apply the products to the neck area. It's always important to treat the neck and the face because the neck is also one of the first signs of aging. So we want to make sure that the neck matches the face, as most people get anti-aging treatment or use their skincare just on their face and not on their neck. Get your client to help you by getting them to lift their chin up, which creates a nice stretch on the skin. And we're adjusting our depth to around 1 to 1.5 because the neck again is quite a sensitive area. And we're doing the same pattern up and down, across and diagonally, covering the whole surface area. We can treat things such as tech neck, Venus necklines, which people get as they age, as the neck has depressor muscles, and when people that work on screens or look down on their phones, they'll have these prevalent necklines. Make sure to cover the underneath of the neck. I'm applying more serum here, making sure the client lifts their skin up, their chin up, and you get that nice stretch. Go under the jawline and cover that whole surface area. As you can see, I keep going for more product and applying that to the skin if I feel that the skin is dry. Applying more product makes sure that the needle has a nice slip and glide and ensures maximum comfort for the client, especially in more sensitive areas, and ensures maximum product absorption, which is the point of the procedure. As well as creating those micro traumas in the skin, we want the skin to absorb the hyaluronic acid based serums that we're using. This ensures that the client is getting the maximum absorption and all of the benefits of the products that we're using as it's penetrating deep into the skin. Now that the microneedling treatment is concluded, we're going to remove our sterile gloves, apply new gloves and apply the mask for the client. Here I'm using the mask from the Ivan Med. Non-sterile gloves, you can now touch the packaging and apply the mask. You can keep these in the fridge for comfort for the client because their face will feel hot post-procedure, which is normal. And this mask will help to cool the skin down. You'll apply the mask from the chin up and adjust it to suit the client and the contours of the face, making sure that it is covering the jawline, and any excess product you can use to wipe onto the neck or under the chin. If you've treated the lips or the eyelids or the eyebrows, you can use the excess serum there also. You'll leave the mask on for around 10 to 15 minutes, and to ensure luxury and comfort for the client, I use ice globes that I've kept in the fridge. And this helps to cool down the face and the erythema and the hot and warmth that the client's going to be feeling post-microneedling procedure. I use these cooling globes on top of the mask to ensure they're not on the skin, which has the micro injuries where the needles have broken the skin, and this ensures that there's no cross-contamination. You will also spray these with alcohol wipes or barbicide to ensure that they are clean post-procedure. When you remove the mask after that 10 to 15 minutes, it will leave a residue on the skin which you can absorb into the area, and then you'll be applying your moisturiser and then your SPF 30 to 50. You want to make sure that the products that you're using post-procedure are gentle on the skin and don't have any fragrances or active ingredients like glycolic acid, vitamin C, etc., as those will irritate the skin. Then you can place your client under an LED light for around 10 to 15 minutes, so this will accelerate the downtime and healing. As you can see, we did not use numbing cream for the microneedling procedure. We don't use this as it can constrict the blood vessels, which may reduce the skin's ability to heal and inhibit the delivery of nutrients and lead to an over-treatment that compromises results. Additionally, that reduced blood flow can actually mask the skin's natural feedback, so you won't be able to tell whether to adjust treatment depth for the optimal results.